Today, we're going to talk about something that should be of concern to anybody who pays taxes and anybody who buys health insurance. So, if that's you, stick around. I have some interesting information for you. Hi, Tony DeWitt here. I'm a Missouri appellate attorney, retired, and I bring you a fresh perspective on the law without offering any legal advice. So, pull up a chair. This is what we're discussing today. Recently, a friend of mine went for a medical diagnostic procedure for a second opinion because she had a sneaking suspicion that the doctor who wanted to perform a procedure on her was doing it more for his benefit than for her benefit. On my advice, she went to a university medical facility to talk with a regional expert in that area. They did the diagnostics and told her she did not need additional medical surgical interventions, and they explained why, answered all of her questions, and she left happy. Nobody likes to have any cutting done on them when they don't need to. So it looks pretty obvious to me that she had identified an unnecessary medical procedure. And there are some pretty massive hidden costs related directly to overuse of medical procedures and other wasteful kinds of activity inside of healthcare. And if you think that the people who are approving your drugs are being overly stingy, you might want to reconsider after you listen to some of what I'm going to tell you here, because I've been in the healthcare profession and I know that there are a lot of things that aren't done necessarily right. Each year, Americans spend trillions of dollars on healthcare, roughly 12 trillion. But what if I told you that a staggering portion of that, hundreds of billions of dollars, goes to procedures and treatments that were never needed in the first place? Now, we're not talking about fraud or fake doctors. We're talking about real procedures formed by licensed professionals that offer little to no benefit to the patients, and in many cases, they carry serious risks. When I worked in healthcare in Florida, I had a doctor that I worked with. I was the special procedures therapist, and I helped do bronchoscopies for patients who needed bronchoscopies. Now, bronchoscopies aren't done under general anesthesia usually. They're done with a little bit of Valium or Versed and some oral anesthesia to numb the airway. So, this particular doctor, it was regular as clockwork, usually around the third or fourth day of the month. He would schedule 4 or 5 bronchoscopies all together. And what was really interesting about those bronchoscopies is that he would go down and he would look around. He would never do any brushings. He would never do any washings. He wouldn't actually do the kinds of diagnostic things that might tell him if there was a lung cancer or some kind of infection going on. He was basically just to look and see, yeah, look through the bronchoscope, nothing going on, pull it out so he could tell the patient, yeah, your lungs are fine. The problem with that is that bronchoscopies are really designed to look at things after something comes up on an x-ray. You get a spot on your lung and the doctor wants to know, is that spot an abscess? Is it a tumor? Is it something that you aspirated last night from dinner? What is it? And so that's when the doctor goes down, and there are little forceps they can grab a hold and take pieces of tissue if they need to get a pathology look at it to tell if it's a tumor or something. All of this stuff is done by really good doctors who are looking to fix a problem. But we began calling these bronchoscopies from this physician Porsche payment bronchoscopies because they happened every month. There were about 5 of them, and we figured that that probably was necessary to cover his Porsche payment. And yeah, he drove a Porsche. If we saw that, and we're not medical professionals, we're just therapists who are doing a job that we're supposed to be doing, Imagine what would happen if you had a team of auditors who really went through the medical records and looked for this. So, today we're going to look at the true cost of these unnecessary medical procedures with a focus on a couple of things: chiropractic care, cardiology, and we're going to look at the overuse and the fact that it's costly and dangerous. So, what is low value care? Let's start with that term. Low value care refers to medical treatments, tests, or procedures that don't help the patient. They may even cause harm, and that they often cost far more than equally effective alternatives. For example, rather than sticking a scope down into someone's lungs, usually you can get a pretty good idea of what's going on with a simple low cost chest x ray. That wasn't what he did. So, an MRI for routine back pain, when rest and physical therapy would be just as effective, is in fact an unnecessary procedure. A heart stent placed in a patient who isn't having symptoms or whose symptoms haven't been documented and found to exist in other testing, that's an unnecessary procedure. It's low value care. And a chiropractic neck manipulation that carries a risk of stroke but no proven benefit is not only an unnecessary procedure, it's a dangerous one. According to the National Academy of Medicine, up to 1/3 of all U.S. healthcare spending, or about $750 billion a year, is wasted. Now, that comes out to about $2,500 for every American in the country. That is a huge amount of money wasted on low value and unnecessary care. So let's take a closer look at chiropractic care. Now, many chiropractors provide helpful, evidence based treatment for musculoskeletal pain. But in some cases, especially with neck manipulations, the risks can outweigh the benefits. Multiple studies have shown that spinal manipulation, particularly in the cervical spine, which is up here, can be linked to serious complications, strokes, the vertebral artery dissection, and even paralysis. Medicare data from the recent years revealed over 200,000 chiropractic procedures deemed unnecessary at a cost of tens of millions of dollars to taxpayers. The financial incentives are built into the system. Chiropractors typically operate under a fee for service model where more visits equals more income. There are few restrictions on the number of adjustments that can be billed, and patients, unaware of the risks, may come back week after week for treatments that are doing little good and possibly doing harm. In 2024, a review published in Chiropractic and Manual Therapies, researchers noted that low value chiropractic care continues to contribute to unnecessary spending and warned that quality oversight is urgently needed. This is not just a billing problem, you see, it's a patient safety problem. Cardiology and unnecessary stents are also a potential problem. Cardiology, you think about heart surgery, well, you think if they're going to operate, it's always necessary, and it's probably life saving. But that's not always the case. Several years ago, I looked at a case, a False Claims Act case, involving cardiologists who were placing stents repeatedly. And what they would do is they would bring somebody in, they would put 3 or 4 stents in. That's a pretty serious procedure. Then, when the patient started to have some additional symptoms, they'd go back in and place some more. And stents are a good thing in a relatively healthy heart because they open up the arteries, they give the heart what it needs to continue to function normally. But when you may need a cardiac bypass at some point and you have all these stents implanted in your cardiac arteries, a lot of times there is no place where they can go in and do a cardiac surgery to where they put in a graft, a bypass. It isn't always possible. So you can harm a patient by putting in too many stents. One of the most overused procedures in cardiology is the coronary stent, a small metal tube. It's inserted into a blocked artery to keep it open. Stents can be life saving during a heart attack, but for stable patients with no active symptoms, multiple studies, including the famous Courage study. Doctors like to have clever little names for their studies sometimes. So, doubtless that has cardiology at the front and evidence at the end. I don't know. But my guess is Courage is an acronym that they invented for the purposes of doing this particular study. That study showed that stents don't improve survival or prevent heart attacks in some patients. Despite this, hundreds of thousands of stents are placed in stable patients every year. According to an analysis by Lone Institute, about, about 1 million stents were placed between 2019 and 2021, and more than 20% were unnecessary. That's $800 million in Medicare spending alone, wasted on procedures that didn't help and sometimes hurt patients. And in some high profile cases, the line between overuse and outright fraud was crossed. In Ohio, a cardiologist was convicted of billing $7 million to Medicare for unnecessary stents and pacemakers. In Maryland, another was sentenced for implanting cardiac devices in patients who didn't need them simply to maximize billing. These cases aren't just shocking, they're a symptom of a system that rewards doing more, not doing what's right. And that needs to change. Why does this happen? Well, there are three main forces driving the overuse of unnecessary procedures. First is fee for service medicine. Doctors and clinics are paid per procedure. More tests, more surgeries, more visits mean more money, even if outcomes don't improve. Then there is this myth of defensive medicine. Some doctors order extra tests or procedures just in case to avoid being sued. While I can understand the idea of having some aversion to the risk of being sued, it leads to a bunch of unnecessary care. We used to call these doctors the ETKM doctors, which stood for every test known to man. You came in for a chest cold and you wound up with an MRI because they just wanted to make sure there wasn't a tumor in there, even though they didn't see one on the 6 chest x rays they did. These kinds of things, under the heading of defensive medicine, studies have shown this is pretty much a myth because doing extra tests doesn't keep you from being sued if you're doing the wrong tests to begin with. In other words, you have to know enough medicine to know what to look for. And if you know what to look for, you don't have to do additional tests. So, defensive medicine does exist and it does cost money, but it has been implanted into the doctor's brains that they need to do this to avoid being sued, when in fact, it's not going to save you if you don't reach the right diagnosis because you didn't look in the right place or because you didn't understand the pathophysiology that was underlying the particular disease that you were trying to treat. And unfortunately, that does happen in medicine. Not to most doctors. Probably 90% of the doctors out there never have a claim. They never have this kind of thing happen. My dad, who was a doctor, practiced for 40 years, was never sued. And then the other thing that's driving this is something called supplier induced demand. Patients trust their providers. When a physician says, "You need this," very few ask, "Do I really?" And even fewer go the next step and say, "You know what? I appreciate your thoughts. I'm going to go get a second opinion." And, in this particular case, the one I talked about at the beginning, that extra step saved a lot of pain and probably a lot of insurance money at the same time. It's a dangerous mix. Asymmetry of knowledge, meaning that the doctor knows a lot more than the patient. Financial incentives, because you get paid more for the more things that you do. And lack of oversight. There isn't somebody watching over the doctors, making sure that they are actually practicing evidence based medicine. As a result, millions of Americans are undergoing unnecessary care at a price we all pay. There are ethical implications too. Doctors take an oath to do no harm, but when procedures are driven by profit or by habit, or by outdated beliefs or outdated clinical models, that oath is compromised. It may not be intentional, but the effect is the same thing. Unnecessary care erodes patient trust, it causes physical harm, it can often cause emotional distress and financial strain. It undermines the integrity of the medical profession. Some patients discover, often years later, that they underwent a risky procedure they never needed. Imagine learning that your heart surgery was avoidable, that your loved one's stroke may have been caused by a neck adjustment, that your insurance premiums rose to cover procedures that no one should have paid for. This isn't just a policy problem, it is a moral one. So, what can be done? Well, first of all, evidence based guidelines are an important tool. Campaigns like Choosing Wisely provide doctors and patients with lists of tests and treatments to question. Payment reform. Shifting away from fee for service to value based care can reward providers for keeping patients healthy, not for doing more. This is sort of the model in the HMO and PPO, although it hasn't evolved to the extent that it's really quality or essentially result based at this point. Patient empowerment. Patients should be encouraged to ask, do I really need this? What happens if I do nothing? Are there other, safer, cheaper options that can be employed? Have you done this procedure before? How many of these have you done before? All of these kinds of things to understand what's truly going to happen. You never want a doctor to tell you, you don't have to worry about any of that. I'm the whiz at this. I don't think you'd really benefit from me explaining what we do. Just know I'm going to get in there and fix your heart, or just know I'm going to adjust your neck and you'll feel better. Those kinds of things are not good things to have happen. You want somebody who can explain it and can explain it clearly. And if they can't do that, then they probably shouldn't be doing whatever it is they're telling you they want to do. And then transparency and oversight. Payers, regulators, and professional societies have to hold providers accountable for following evidence, not incentives. Unnecessary medical procedures aren't just wasteful, they're harmful. They drain our resources, they endanger our health, and they violate our trust. And they increase the costs in the medical profession because when you don't do evidence based care, you are much more likely to make a mistake or commit malpractice. Now, this isn't hopeless. With better guidelines, better incentives, and informed patients, we can turn the tide. But healthcare should be more about doing what's right, not just doing more. I think that this is something that you need. If you have worries about your physician, if something tells you that you're being dinged for stuff just to make money for him or her, maybe you need to step back and think about your choice of physician. I'm just saying, if uh, if somebody did that to me, I'd be pretty upset about it. So, if you find this video helpful, share it. You might even consider sharing it with your elected representative, somebody who has a vested interest in reducing our federal budget. If we could save $750 billion a year, that's $750 billion. Imagine how much better our budget would be, and also think about how much better our health care would be. That's what I have for you. Thanks for watching. That's what I have for you today. I hope you found it helpful, interesting, or maybe both. If there's a subject you'd like me to discuss, please feel free to send me an email at the address above. If you like what we do, please feel free to subscribe and come on back to the beach tomorrow. I release videos every weekday, weather and work permitting. If you have the opportunity today, do a kindness for your fellow man. It makes the world a better place, one kind act at a time. And now, YouTube has some suggestions for other videos of mine that you might like.